Let's talk about rhinoplasty. Rhinoplasty is a medical term that describes cosmetic or functional, that is, improving the airway, enhancement of the nose. There are many types of rhinoplasties out there. There is a traditional ethnic rhinoplasty, Caucasian rhinoplasty, rhinoplasties that involve patients that have had a large part of their nose lost from cancer, or even rhinoplasty for trauma if there's been an accident in the past. I'm going to try to emphasize for you today the standard rhinoplasty. For example, either taking a little bit of a hump down in the western nose, or the opposite of that, which is a little bit of enhancement of the nose for the Asian or ethnic patient. What I try to do in this little video is sort of walk you through the process so that you're comfortable in understanding what the procedure entails and also what your recovery period will be like. The procedure is done in my surgery center in the comfort of general anesthesia. I am very focused in delivering general anesthesia for you because, for me, rhinoplasty is a high standard of an art. I have to preserve or enhance your airway and also make sure that your result is perfect. It's a procedure involving fractions of millimeters. So what's so important is that you have a good sedation where you're really under general anesthesia so that there is no discomfort and that I can have the most precise control in achieving the results that I'm looking for. In terms of your recovery, if you've ever seen the extreme makeover shows or the shows where you see a lot of bruising, I simply don't get that with my patients. I have yet to see it. Now, I don't want to tell you that and you have some bruising, because bruising is possible. But oftentimes the sort of gross deforming bruising is something I simply don't see because of the fine instruments I use. So let me walk you through the recovery period. For the first week, you will have a splint on your nose in almost all cases. The splint is really there to help hold either a graft in place or keep the bones in alignment if I've moved those little bones to where I would like them to be. And that splint really should stay on for the week. I usually ask you not to take a shower to get that splint wet during that week if possible. There'll be tiny sutures below the nose. I use a procedure called open rhinoplasty, which really allows me to get the most precise results that I humanly can get. Those sutures are removed at a week. As I said, at the end of a week, you really don't get much bruising, if any, but there is still a little bit of swelling, usually not deforming swelling. When I tell my patients how much time they need off from work, I usually say about a week. Now, you're not 100% there by any stretch of the imagination. When you come in for consultation, I will actually walk you through photographs of my patients at about a week or two, at about a month, at about 3 months, 6 months, and beyond, so that you really can truly appreciate the recovery time photographically. What you're going to appreciate in these photographs is truly that there isn't much of a recovery to be had. If you're asking in terms of if it's sort of more visible for someone looking upon you, I would say the first week, yes, obviously because you have a splint. Your second week is a time where it's getting better and better and better. But rhinoplasty is one of those things where it continues to improve over a period of an entire year and beyond. I'm very much a perfectionist. I see my rhinoplasty patients at about a week to take care of the splint and sutures. I see you back roughly at a month and then 3 months and beyond, really just making sure that that result is as perfect as I can give you and as proud as I would want to be with it. I hope that explains a little bit about what rhinoplasty is all about.